Good afternoon. I would like to thank organizers who invite me to present what we are doing at the European level. And I will start my presentation. I am working for Υγεία Europe, and I would like to start my presentation to introduce Υγεία. And we will continue with the eHealth Interoperability Framework, something that most of the countries are starting or have already done for their eHealth strategy. So first of all, Υγεία Europe. So I would like to present Υγεία. Υγεία is an international non-profit organization. It was created in 1998 and is also an ISO liaison forum with two kinds of audience. Healthcare professional and they are working all together to define and to specify and also to test interoperability solutions that answer the need of the users. This is the main focus, and I think the success of Υγεία is there. It means that you have the user on one side, they are speaking, they are explaining their needs, and in the other side you have the vendors who have the solution and try to adapt their solution for the needs of the users. This is the first thing, and they develop some specification, but the success is also not to say, okay, you have specification and go with that, is also to test that this specification works. And Υγεία organize what we call test event called connected. So, as I said, they develop a framework based on what we call also profile, and then can organize all the exchange within and between organizations. They promote also MBA's selection and coordinated use of established healthcare and IT standards to address specific clinical needs. It means that the profile is a set of standards, because when you have a need, and this need is expressed by a use case, you develop specification that you see that you need several standards for answering your needs, your use cases. And generally when you use standards, even if you specify, there is some overlap, you have some gaps, and then Υγεία profile develops this specification to better use all the standards, this kind of implementation guideline. Today, Υγεία at the international level is more than 600 members with user association, hospitals, national center of competencies, industry, governmental agency, and research institute. So it's a big community and well developed over the world. In Europe, we have what we call a national initiative, so it's Υγεία Europe, and it's a deployment committee of Υγεία International. What is a deployment committee is a committee who is not developing directly the specification, because the specification are developed at the international level, but they support, they help countries at the European level to adopt and to promote and to implement Υγεία profile. And then we have this IHE Europe, and in each country, because we need to be in the ground, in each country in Europe, we develop some national initiative doing the same work, but they are federated at the IHE Europe. So you see the map on the top with different countries who are already in IHE Europe. In IHE Europe, as I said in the beginning, we have users and members. And then this association, as well at the international level, we have always two co-chairs. One is representing users and one is representing vendors. So we need this equilibrium. And for IHE Europe, for example, we have Peter Maddenberger as a radiologist for Germany hospital, and we have a vendor, Lapo Bertini, who is from Dedalus, so a company, an Italian company. IHE Europe has different committees, but today we have two main committees. One is called EU Affaires, and the second is IHE Services. EU Affaires develop awareness of the European Commission, policymakers and stakeholders on eHealth interoperability, and more specifically on IHE profile. We contribute in European projects. And we develop also support training and support IHE initiative when they are asking us. I am working more in this committee, and I'm leading some European projects for IHE Europe and contribute in the project, European project. IHE Services is an operational committee. They support also project, so it's more operational. Organize test session, develop the testing tool. I said that we organize every year connectathon, so we need tools, and then IHE Services develop this Gazelle, what we call Gazelle testbed platform, and all the testing tools. With IHE Services support also implementers and the project, and start the activity of conformity assessment testing. This is an overview of what is IHE and their activities, and I will did not finish. And this is a view of all the international participation you see in the world. There are a lot of countries now. From America, North America, Europe, and Asia. So the last one, the baby, in 2015 is Belgium. I know there is someone from Belgium here. So, this is the last one, so IHE Belgium. As we said, the standards are not sufficient. They are fundamental, and they are the foundation. But they are, as I said, broad. There are several interpretations of the standards and implementations. And also, generally, you have also some overlap between standards, or there are additions to have gap. This is the reason why IHE developed this implementation guideline. I think José will explain more in detail what is the concept of IHE profile with different concepts, but it's important to know them for the next slide. Is that we have the key concept is the use cases, so the needs of the user. And then you have specification profile. Profile is a set of standards, and they define what we call actors. Actors is a function of the system for exchanging information with other systems, and transaction, so is what we exchange between systems. So now interoperability in Europe, and we find eHealth Interoperability Framework. This morning you had the presentation and also discussion on JASN, and this week European Interoperability was also presented and explained a little bit. I will go more in detail. I would like to remind you the eHealth challenges that were discussed this morning with the four views. The first one, of course, we are health is for citizens. So, and now what want citizens? They want to be more responsible of their health. They want to be more involved actively also in their health. They want an easy access to the medical information and legal side and everything concerning their health. And they need trust for new products and also mobile application, as we discussed this morning. On the other side, you have the healthcare provider. Of course, they want more quality for the benefit of the patient. They want also to access to medical expertise. Now we know that the care and medical expertise is more complex, and you need collaboration with other professionals. It's now very important and crucial for the quality of care. You need an easy access to patient data for care. For example, in the case of emergency, when you have someone in the road and you need absolutely some information about the patient, so easy access. They need easy access to the patient data. Government, of course, they are managing the health strategy. They are managing the population of the country, prevention and public health, and of course now with the cost effectiveness. We are not saying cost only, but the right cost for what we want. The message was also said this morning, is a political issue on one side. Is all of us we need to have a good health. And at the end, so the market, single market, new technology and innovation are rising now. More and more development of devices, how to manage these devices, big data, and also we need more connection between systems. This is the market, and we have to deal with all these point of view for the continuity of care and the well-being. And for that, so more and more connection between people, but also between systems. If we say between people, of course, it's between systems that support their collaboration. And for that, we need interoperability and standardization. Of course, privacy is important. It was also said this morning. Safety and security. But as one person in France said, and I am completely agree with him, security since the safety of the patient is there. Because we need the first thing is safety. The concept of interoperability, you saw this more or less this slide this morning, just to say this four-level: legal, organizational, semantic, and technical. When you are in the country, legal generally is the national regulation, so the legislation is more or less harmonized, and you need to deal with this when you are working on cross-border. Organizational, so it's an agreed and coordinated process, more and more today. And then you need to agree on the common goal and common for different organizations. Information is semantic, and also it was discussed this morning with the KIC. And at last, technical aspect is all the planning and technical issue for exchanging information, and here we have, of course, profile and standards. Next one, also you see that, but I add more information about all the directives. There are a lot today because of this digital agenda also. It's like a green paper to develop some kind of roadmap for digitalize Europe and to have a single market. But we have more and more support with the European Commission, with the MOU on eHealth, Europe and the US, the multi-stakeholder platform on ICT standardization that help also countries to choose and to select the good standards and profile for the future, and connecting Europe for facility for cross-border exchanges. So this is the overview at the European level, but we need, there is one condition, there is a requirement, is a consensus. Consensus on a common interoperability framework for an harmonized implementation on eHealth in Europe. And then, during the 4 years, it was developed this eHealth European Interoperability Framework, and now it's a refined eHealth Interoperability Framework delivered by the European project beginning of this year. And it's setting up a quality control for interoperability in testing various models of quality level and certification of solution, and also offer a methodology and tools that support this definition of new use cases and establish also a list of use cases. This interoperability framework is a cookbook, I would say, and deliver methodology and tools for doing your own eHealth European Interoperability Framework. You will find then a set of use cases, a set of templates, if you want to define your own use cases, define a model for interoperability, glossary, term and definition, overview of interoperability profile, so all the tools that you need for defining your own eHealth interoperability framework in your country, based on what is presented at the European level. This is the list of use cases, and now they are endorsed by the eHealth network last week. So we have this list explaining which the domain and different domain, medication, radiology, patient summary, and so on, and where you can use it, and have a description of use cases at the different scale. So at the cross-border, at the national or regional level, or in hospital. And the work is not finished, and we are working in a new project e-standard to define new use cases. And the first things that we did, we said, okay, you have all the tools, but for the moment, it is written on the document what is the best for user, for who want to develop their own interoperability framework. Is an easy tool that supports all the use cases with multi-criteria that help then the new developer of interoperability framework, defining all the use cases with the multi-criteria. For example, you want to define your own, you have an idea of your use cases, you have a need. You say, is a hospital, so you can select hospital, and you have the already existing use cases available. It's the first time I show this picture, because the database is very new. So there are some bugs today, but we will correct during the 2 weeks. And you have this, I think time is running, I will go, and you have different type of scenario, and at the end, for example here, you have a description of mobile services to empower patients with heart failure, with a description of the scenario, and at the end, you have a list of profiles related to these use cases. So it's easy to use, is a public, and you go on the website and see what happened. In this, at the end, so in this interoperability framework, you have 27 IHE profile described, and the Commission decided to identify all these 27 profiles for referencing them in public procurement. With this rationale, so standardization has an important role in supporting the European 2020 strategy for the completion of the digital agenda, and that can be used in the procurement. I think time is running. Okay, so I will finish only with this one. So I show you the material, now how to use it for this interoperability framework. In a country, you are at the national or regional level, you want to describe your eHealth interoperability framework. So first of all, you have your own strategy, your own objective. For example, it's just an example, reduce costs of medication, optimization of care processes, and so on. And you go to the repository or to the interoperability framework, use the templates, select use cases already existing, recognize you have the standard profile, you define your own interoperability framework, and you add, for example, e-prescription is your use case for border patient summary exchange, and you add for your own purpose some specificity. For example, your own regulation has an impact in the use cases, and then they have also an impact in the standard and profile, and you add what you need, and then work is done. So this interoperability framework will help you, will support you, and facilitate, and it's more easy for you to develop very quickly your own eHealth interoperability. So I will stop here because I have the second part on the testing for the bootcamp. So the next part for the bootcamp. Thank you.